on the web and in your hands. This is MDiTV.
You've seen the ads, but romantic failure may not be the most serious thing to worry about. Erectile dysfunction may be a warning sign of cardiovascular disease, including heart attack and stroke. It makes sense that erectile dysfunction and heart disease might be connected because they both have to do with how well blood vessels are working. A number of studies have made this connection. What the authors of the latest study wanted to find out, though, was whether erectile dysfunction might improve the accuracy of risk predictions that are based on traditional risk factors such as smoking, high blood pressure, and family history. They published the results of calculating heart disease risk factors for over 1,000 middle-aged and older men in the Journal of the American College of Cardiology. And while erectile dysfunction does point to increased heart disease risk, it doesn't make those predictions any more precise than the usual methods. That's frustrating because so many men fall into a middle range of risk, so it's hard for doctors to pick out the ones who would really benefit the most from aggressive measures to reduce risk. Although the researchers were disappointed that adding erectile dysfunction to heart disease risk formulas didn't help them predict the future any more clearly, they say knowing about trouble in the bedroom might still help save lives.
ED can be assessed very easily, okay? So when a patient comes in and presents with erectile dysfunction or ED, the health professionals seeing that patient should work the patient up for CBD, as there may be, I think, a window of opportunity for men to improve their health.
Men don't like to go to the doctor, right, guys? Behavioral health expert Dr. James Mall says that's typical.
A strong, virile man, a rugged, healthy man doesn't need to be screening and worrying and fussing about their health. If they feel good, their health is fine. Might be a typical way of looking at things.
Men tend to wait until something's really wrong, and well, what could be more wrong than failure to perform? So the researchers who are building evidence about how often erectile dysfunction and heart disease go together say that when a guy comes to his doc asking for help resurrecting that honeymoon feeling, instead of just reaching for the prescription pad, they should also look for a heart that might be about to break.